Stefan Barghorn, AbbVie, monitoring Alzheimer's disease therapy with early biomarkers.
I will talk about monitoring Alzheimer's disease therapy with early biomarkers. Imagine you have Alzheimer's disease with memory impairment, disorientation, mood and behavior changes, and a loss of social behavior and language. Auguste Day, Alois Alzheimer's first patient, described these clinical symptoms with, "I have basically lost myself." Oh, that will be a nightmare. In Alzheimer's disease, there is a massive loss of neurons, accompanied by an accumulation of the tau protein into neurofibrillary tangles and of amyloid beta peptide into amyloid plaques. We as a pharmaceutical company want to develop drugs that stop the further progression of Alzheimer's disease. But how can we measure the efficacy of our drug treatment? Alzheimer's disease is diagnosed by cognitive tests, brain imaging, and measuring cerebrospinal fluid biomarkers amyloid beta peptide and tau protein. But the changes, how can we monitor drug treatment? The changes in cognition and imaging occur rather slow and are rather imprecise. And for the changes of amyloid beta and tau protein, an efficacy correlation is yet unproven. Hence, we defined our biomarker goals that it should directly monitor drug action, is relevant for Alzheimer's disease, and that we have an animal model for drug testing available. How did we address these biomarker goals? I will never manage that. Okay, in Alzheimer's disease, the protease calpain is overactivated. This is our drug target. The spectrin is cleaved upon calpain activity into spectrin fragments, which is our biomarker. Upon inhibition of calpain, the spectrin fragment biomarker should directly decrease, and this is our biomarker then. Unfortunately, there was no assay available measuring spectrin fragments, but we were lucky to be able to develop one. In conclusion, measuring spectrin fragment biomarkers fulfills our first biomarker goal and is directly linked to calpain activity. Using our newly developed biomarker assay, we could show that in Alzheimer's disease, in human CSF, the concentration of fragment is increased significantly versus control subjects. And hence, we fulfilled our second biomarker goal to show the relevance for Alzheimer's disease. Next, we looked into an animal model and could show that spectrin fragment is significantly increased in these rat brains, and that also translates into the CSF of these rats, and hence fulfilled our last biomarker goal to show that we have an animal model available. In summary, we could show that we have fulfilled our biomarker goals of directly monitoring drug action as relevant for Alzheimer's disease, and I come to the end. I'm sorry, but that pointer really doesn't make it. We will apply these spectrin biomarkers to show proof of concept in animal models and apply them to the trials. Thank you.